You're listening to the Business Communicators.
Trust is also incredibly important. And Thomas, you shared an article in our group thread from the New York Times, and the headline really stuck out to me, and it was, "We're underselling the vaccine." And for those that aren't familiar, obviously the COVID-19 vaccine from Moderna and Pfizer has been rolling out throughout the country, and polling numbers suggest there's a lot of skepticism about the efficacy of the vaccine and whether or not people should actually get it. Dr. Fauci said last Thursday in his first press conference with the Biden administration that he hopes that by the fall that we can get up to 75 to 80% of the U.S. vaccinated, and that we can really start to return to normal at that point. But Thomas, I did think the article was interesting, and tell us a little bit more about it.
Well, yeah. So the article saying 95% effective, it was a yes or no. So meaning that if you caught COVID and only had super mild symptoms, it was still considered a no. But it really plays into the ability that people are cherry picking the information they want out of it. 95% is a phenomenal number, but that's still 1 in 20%, 1 in 20 people that are going to get COVID if they get the vaccine. But the other thing that jumped out at me about this was how the distrust. It kind of talks about how the distrust kind of started to form. Whereas when the COVID first started coming out, don't wear masks to the public, but we need all the masks for the caregivers, the PPE, and in hindsight being 2020, you understand where that was coming from. But then you go from don't wear a mask to wear a mask. Don't do this to do this. And yes, in the time of crisis, I get it that, I had 20 things to think about when you're going through a crisis. And one of them was the facts, while interesting right now, are completely irrelevant. It's one of those that you have to think about. What's the implications of this? How is this going to affect? Because if you change your message every 2 seconds, you don't have that trust. Then it becomes down. Why do I want to believe this?
And it seems that that's one thing that's been lacking, since last March, is that clear and consistent communication. And I think, as the Edelman Trust Barometer, which we'll talk more about next week with Edelman, shows, is that there's a lot of distrust between Americans and the government, Americans and the media. And how do we rebuild that trust? Is it through effective communications, being fully transparent? I think that's part of it. And we're actually going to discuss this more with IABC Houston. If you're located in Houston, we'll have it up on the website shortly. But February 25th, we're going to have a webinar with communications related to the vaccine rollout and how local officials have dealt with it, how hospitals have dealt with it. And so stay tuned for more information on that. But Hattie, I did think the article was interesting, that the messaging, even on the vaccine and the efficacy of it, that it's not being communicated effectively, that 95% efficacy rate is incredibly good and unheard of. And I'm not sure that story is being told correctly.
I agree with you on that. And when you talk about not only communicating effectively, it's not consistent as far as the message. The other part of the distrust is, some of it is cultural distrust. The African-American community distrusts the effectiveness of this vaccine based on, I don't know if you remember the Tuskegee experiment.
Yeah,
and
I was about to say that, Hattie.
But what was really interesting is GMA had one African-American doctor on to interview, who told the story about not only her experience, but her colleagues' experience with the vaccine. And that is something, from that cultural standpoint, we need to see more of, and need to see it consistently to be able to effectively resonate with the cultural community. The other part I've also learned from other folks is regarding not only the effectiveness of the vaccine, but where is it? In some areas, you don't even have enough vaccines everywhere. So it's hard to communicate about the effectiveness about something that's not even available at that time. But if you would, I would say that we talk about the 95% and all of that, but what dies down and what got distracted is the fact that people are upset about there's no availability. So the effectiveness just kind of got kicked to the curb for a minute. So you got to bring that back and bring it back more forcefully and keep it out there in front of people. So when it is available, they're saying, okay, I'm signing up. I'm getting it.
Well, that's been the frustrating thing, and it's not something that's just unique to the United States. It's something that's happening globally. Is the distribution of the vaccine it's been horrible. It's the access to it, who can get it, where they can get it. It's frustrating. And what bothers me most is we've known since last March that there was a vaccine that needed to happen. That a vaccine needed to be rolled out, and that a vaccine was critical for the world to try to get back to normal. And the fact that like logistically it wasn't planned out, that they couldn't have strategies in place to have, like, for example, in some states, more people are eligible to get the vaccine than others. There are more distribution sites. Some states are saying that, if we have excess vaccines, you could sign up basically on a lottery and come and get it. Other states are saying, if you don't follow our exact protocols, we'll take the vaccine away from you. And that to me has just been so frustrating, just from like an internal communications perspective, is our government officials and our healthcare workers, I think they're failing right now in terms of cooperating with each other and having this like interagency or interbusiness, this B2B communications. I think they're failing in that. And I think that's also maybe playing into some of this distrust.
I agree with you on that one.
Too many cooks in the kitchen. Too many cooks in the kitchen. That's when it boils down to it. Everybody wants to direct the traffic, and here's how we're going to do it. But then when it comes time to put the rubber to the road, they haven't thought about how to do that.
Control.
Exactly. If the operation lines are not there. So yeah, there's a ton of distrust, and from going back years and years and years and years, America is not a perfect society by any stretch of the imagination, and it's taken a lot of time to get where we are. It's taken a lot of times to get where we are. Whether it's the Tuskegee Airmen or the internments of the Japanese Americans or the Native Americans way back when. But it's one of those things that as long as we're trying to get better, but at the same token, why do we keep making the same mistakes over and over again when it comes to these kind of things?
I love your operative word. Trying.
I mean,
it just blows my mind.
I think it goes to show the power of the communicators, and right back to what we said to, with Amanda Gorman, like, you need the right person to communicate. You need the right person to distribute the message. We haven't had the right person in place for decades in the United States, globally. It's just, that's the frustrating part. Like, have your local leaders out there that people trust, giving out this information. Don't just have, the top of the line, president of the country who half the country supports, half the country doesn't support. I don't know. It's just, how do we move past that? Because that's when you look at the vaccine from a technology perspective, mRNA, I know there's not a lot of information out there right now about mRNA vaccines, but it's incredible. I mean, you look at what it can do, the technology behind it, it's just insane. And they've actually found that some of the COVID vaccines have been effective, like at least taking some of the technology from the COVID vaccines has been effective in fighting multiple sclerosis. And that's incredible too. But that message isn't being told. And I don't know, like, how do we cut through the noise, all of this rhetoric to have clear and consistent information, especially when lives are on the line? I think that's the frustrating part on my end.
Yeah, people are going to have to get their stuff together. That's just my polite word for it, because we all got to get on the same page. And when you say we have to get that consistent message out, but you got to get the right person in charge who is going to say, hey, cut the crap. let's get it together. Let's make sure we have this available. Let's make sure we're telling the story of how effective it is. And we're all saying the same thing when we do say it, and get it out there on a more frequent level. We've got to rebuild a lot of trust.
I think the real challenge is everybody thinks they can do everything, and communications is probably the biggest victim of this whole aspect, because everybody can talk. Most people can talk, most people can write, most people can read. Hopefully everybody, but working in the medical field, I consulted with a doctor one time where he was getting a bunch of complaints asking about why are they ordering these tests on their children. And he's like, well, I'm ordering this test because 5% of kids who present these things, will have that. And I said, well, what if you said instead of 5%, 1 in 20, making it relatable? Because 5% means, oh, well, then there's 95% chance that my kid doesn't have it. But now if I say 1 in 20, that's the size of a kindergarten classroom or a first grade classroom. 100%. Oh, wait, putting it in that terms. And so I think what it boils down to it, and I'm picking on healthcare because that's what we're talking about, and I have some experience there, but you have these politicians, you have these professionals who are really, really, really good at their task. They're not really, really good at communications or operations or strategy. And so I think that we all need to take a step back and be humble. Like, if I need an internal comms person, I'm going to go to Hattie every day of the week. Hey, we're doing this. Hattie, put your eyes on this. And so it's understanding our weaknesses, and it's reaching out to those experts. And I think that's something that we as communicators need to do, but we need to also continue to show and lean on our presenting sponsor, IABC Houston, and all of the communications disciplines and organizations, just to truly show that this is how we help you. And it's not a cost center.
You just brought up something that made me think about something. Thank you. Who says the doctors don't have communicators? Sometimes communicators may not ask the right questions because they don't understand all of those big words or medical words and things like that. But sometimes, we get into this place where, oh, well, that doctor knows exactly what he's talking about, so I'm going to write it up and get it out there. Or maybe this is not something we need. So it's also about having that right expert in place as a communicator to probe a little bit more. We got to start asking more questions and better questions. And
on that note, do you have a little bit of breaking news? I alluded to the IBC panel that's going to happen on February 25th. Just got the confirmation text in our group chat that we have Christine Dobbin, who is a very trusted former journalist here in Houston. She's going to moderate the panel with vice presidents from St. Luke's Hospital, Harris County Health, and the CEO from DN Clinical Research. And so I'm really curious to hear their perspectives on what has worked, what hasn't worked, how they can improve.
Yeah.
Absolutely. But saying that they don't have communicators on the back, that, I don't know what their staffs look like behind the scenes or anything like that. But even the most seasoned medical professional, the best infectious disease doctor in the entire United States world, had a gaffe at the start. Don't wear masks, but yet the mask need to be used in hospitals. The logic, the logic was there. We need to save the masks so there's not a run on them for the people who are going to be treating this illness. But the way he said it didn't come out. Whereas an expert communicator might have been able to say, hey, time out. That's not a good idea. We talked Pizzagate, where the CEO said, this is what we're going to do. And the communicator's like, that might not be a good idea. And, wound up costing some business for that firm.
I will say, though, to credit Dr. Fauci, I think overall, when you look at his response through COVID-19, he's been very calm. He's been very transparent about facts, even realities when people don't want to hear them. Mm-hmm. And I think he's got a calming sense about him. I mean, when you look at his trust numbers, they're higher than, elected officials. And I think his reputation is phenomenal. Has he admitted to maybe wishing that he could say things differently? Absolutely. We all have done that. But I think he's done an incredible job. And I think he's an ally to the communications professional. he understands that. I mean, that's why he's going on all of these networks, and it's not to boost his personal brand. I mean, if he was really concerned about his personal brand, he would be in the private sector right now, you know, making
But you also
millions.
remember he got muzzled at one point.
Oh yeah, by the Trump administration. Absolutely.
So he's been interviewed in all the magazines that I read during that particular time. And it's been controlled about what he's supposed to be saying and what he's not supposed to be saying. But for him, I think he's been kind of true to what he's been saying. Yep. He stayed on course. He stayed focused. He stayed this, you know, it has been a yeoman's job, but now he's back and he has an opportunity to help that administration build back. So we're going to be able to see, you know, what's going to happen from here and see how it's accelerated in getting this vaccine out, distributed, communicated about, and what have you.
And to close my thought on Fauci, he understands the importance of communicating science effectively. Like, science is very, very complex. There's a reason why all three of us are communicators, and it's because we were terrible probably at STEM. I know. Well, I'm speaking for myself. My GPA can prove it. But but Dr. Fauci understands the power of communicating complex issues in a way that could be understood by a broad community. One other thing that I respect about him is he's not too proud to admit when he's messed up. And Absolutely. That is a trait of a leader that I want leading the rollout of fighting this infectious disease.
Absolutely.
Absolutely. And I'm going to change subjects a little bit because I kind of scrolled down that New York Times article. And just to say, while I said America's not perfect, I am very thankful that we do live where we are, because in there it also talks about Alexei Navalny. I don't even know how to say his last name. Navalny. He's the opposition leader who was poisoned, treated in Germany. He arrives back into Russia and is arrested on the spot, you know, just for speaking his mind and his point of view. So while we sit here and we talk about all the different things and communications aspect of it, I'm thankful that we live in a place that we can have open and honest and hopefully accurate communication dialogue back and forth with different opposing views.
Yeah. And I think our message and our takeaway from this is we're not the experts when it comes to vaccine rollouts. We don't necessarily know what the best approach is, who should get it first, where these distribution centers should be set up. We're commentating on it from a communications angle and how our combined knowledge, you know, our backgrounds on internal comms, data analytics, PR, digital, how we would maybe adjust and refine some of the strategies that have been implemented to make it more effective. And so if you have thoughts on this, you know, maybe what your company has done, maybe you work at a hospital, let us know, you know, what has been effective for you guys. You know, shoot us an email, podcast@ibchouston.com, or go to the businesscommunicators.com, and you could just fill out the contact form there. Let us know. But what strategies have worked for your company, whether it's about the vaccine rollout, whether it's about testing, whether it's, you know, working from home, what has worked well for your company? What has been effective in your line of work?
You've been listening to the Business Communicators.